We're checking on the condition of the son of LeBron James. Bronny James remains stable but hospitalized after going into cardiac arrest during a practice at the University of Southern California earlier this week. And you can see support just pouring in. USC issued a statement saying medical staff was able to treat Bronny and take him to the hospital, and quote, LeBron James and his wife Savannah wish to publicly send their deepest thanks and appreciation to the USC medical and athletic staff. Ohio lawmakers are pushing to require automated external defibrillators, or AEDs, in more public places. The House, in fact, passed legislation last month. House Bill 47 is currently going through the state Senate. Joining us this morning is Dr. Naomi Kertesz, who's the director of electrophysiology and pacing at the Heart Center at Nationwide Children's Hospital. Doctor, we're so glad that you were up early and joining us. I wanted to have you start by reminding our viewers about the difference between cardiac arrest and a heart attack.
So a cardiac arrest means you become unconscious from a cardiac event. There's actually no way to tell when somebody faints whether they're having a heart attack or a cardiac arrest. The beautiful thing is when somebody becomes unconscious from a cardiac event, you do the same thing. You call 911, you start CPR, and you get your AED. So you actually don't have to make the distinction between a heart attack and a cardiac arrest. A heart attack is a type of cardiac arrest.
And then for someone who sees this story of what has happened to Bronny James and they're concerned about their child, a lot of schools are doing those screenings as students go back to school to prepare for their sports in the fall. What is the takeaway message for them in terms of whether their own child is at risk?
So I would actually like to say to you that it's very difficult to figure out who's at risk. The reason being there are three major causes of this. One is structural heart disease that you may pick up on a screening, electrical disease that you may or may not pick up, and then situational, where you can have an infection or potentially get hit in the chest like we saw with Damar Hamlin. So what parents need to realize is trying to prevent a sudden cardiac arrest is virtually impossible. What we want to do is prevent a sudden cardiac death. How do you do that? You make sure that there's an AED available and someone who knows how to use it. We at Nationwide Children's have are a Project Adam affiliate. We will come to your school, we will train your teachers, and we will deem you heart safe. In order to be heart safe, you have to have an AED and you have to run a drill once a year. Because if you don't run a drill, then nobody knows what to do when someone faints.
And doctor, before we let you go, can you talk really quickly about how easy the training is?
You can go onto Nationwide Children's and there is a video on how to use an AED. Every teenager and adult should know how. The training that we give can take 15 minutes. If you want, we can do it in an hour. But we can train your staff and we can make you heart safe.
Great. Thank you so much, Dr. Naomi Kertesz with Nationwide Children's Hospital. Some great information there. Thank you. And we will make sure you can get that information on our website so that if you want to get that for your school district, you can do that.
And one of the most important things that Dr. Kertesz just said too, even before you get the AED and start CPR, is you call 911.
Yes.
Because then you know help is on the way. Because you could be in the middle of CPR and realize I can't stop and I haven't called anyone to help out.
And having that access to that AED is so critical. So that's what we're saying. Well, certainly